Masuk.
Oke, baik. Untuk kuliah pakar pada pagi hari ini akan segera dimulai. Bagi yang belum konten, diharapkan masuk sore. Oke, teman yang belum konten diharapkan untuk konten. Baik, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Selamat pagi dan salam sejahtera bagi kita semua. Alhamdulillahirrabbilalamin wa bihi nasta'in wa ala umurid dunya waddin. Assalatu wassalamu ala asrofil anbiya'i wal mursalin sayyidina wa ala alihi wa sahbihi ajma'in amma ba'd. Puji syukur kita panjatkan kehadirat Allah Subhanahu wa taala atas limpahan karunia dan rahmatnya sehingga kita dapat melaksanakan kuliah pakar teknologi laboratorium medis Universitas Aisyah Yogyakarta tentang about how tuberculosis is diagnosed, screening, and lab test. Salawat serta salam talba pula kita aturkan kepada junjungan kita Nabi besar Muhammad SAW yang telah membawa kita dari alam kegelapan menuju alam yang terang benderang. Kami ucapkan selamat datang pada yang terhormat Ibu Lisa Wahyuningrum, Sarjana Terapan Kesehatan, selaku penanggung jawab mata kuliah pemeriksaan laboratorium infeksi bakteri. Yang kami hormati Ibu Wida Ninggar, Sarjana Terapan Kesehatan. Yang kami hormati Dr. Mehrum Nisa, PhD, Doktor of Philosophy selaku pemateri dalam kuliah pakar kali ini. Yang kami hormati seluruh dosen yang sempat hadir dan juga teristimewa teman-teman mahasiswa teknologi laboratorium medis Universitas Aisyah Yogyakarta tahun angkatan 2021. Baik, perkenalkan saya Imam Gagali selaku Master Ceremony akan membacakan susunan acara kuliah pakar pada hari ini. Yang pertama yaitu pembukaan, yang kedua yaitu sambutan, yang ketiga yaitu penyampaian materi, yang keempat penyerahan sertifikat, dan yang kelima yaitu penutup. Acara yang pertama yaitu pembukaan dengan mengucapkan basmalah. Bismillahirrahmanirrahim. Kuliah pakar teknologi laboratorium medis pada hari ini dibuka. Beralih ke agenda selanjutnya yaitu sambutan. Sambutan yang pertama akan disampaikan oleh penanggung jawab mata kuliah pemeriksaan laboratorium infeksi bakteri kepada Ibu Lisa Wahyuningrum, Sarjana Terapan Kesehatan. Dipersilakan.
Baik, terima kasih untuk Mas Imam sebagai Master of Ceremony kuliah pakar pada pagi hari ini. Sebelumnya saya ucapkan terima kasih atas kehadiran Dr. Mehrunisa dari Uni Kuala Lumpur, kemudian mahasiswa dari Universitas Kuala Lumpur, dan mahasiswa TLM Angkatan 2021 yang saya banggakan. Pada kesempatan pada kuliah pakar hari ini, untuk tema yang akan kita bawakan yaitu How Tuberculosis is Diagnosed, Screening, and Lab Test, yang nanti akan disampaikan oleh Dr. Mehrunisa dari UNIKL berkaitan dengan telah selesainya pelaksanaan kuliah tutorial pemeriksaan laboratorium infeksi bakteri, yaitu salah satunya kasus yang membahas tentang diagnosis infeksi tuberkulosis. Nah, nanti untuk kita menyamakan persepsi ilmu dari pemeriksaan laboratorium akan disampaikan oleh Dr. Mehrunisa. Mungkin itu saja yang dapat saya sampaikan. Semoga teman-teman bisa mengambil ilmu yang telah disampaikan oleh narasumber. Terima kasih. Saya akhiri. Wassalamualaikum warahmatullahi wabarakatuh.
Baik, itulah tadi sambutan yang dibawakan oleh Ibu Liksa Wahyuningrum, Sarjana Terapan Kesehatan. Kepada Ibu kami ucapkan banyak terima kasih. Selanjutnya beralih ke acara inti, yaitu penyampaian materi yang akan dibawakan oleh Dr. Mehrunisa, PhD, Doctor of Philosophy, yang akan dipandu oleh moderator kita, yaitu Saudari Diawina. Kepada moderator saya persilakan.
Baik, Assalamualaikum warahmatullahi wabarakatuh. Thank you to the Master Ceremony, Imam Ghazali, for the opportunity that has been given. Good morning, ladies and gentlemen. Welcome to the expert lecture today with the theme How Tuberculosis is Diagnosis, Screening, and Lab Tests with the great speaker, Dr. Mehrunisa, PhD, Doctor of Philosophy from Kuala Lumpur University. And today is a great honor for me, Dia Winasari, and Mrs. Widaninggar, who will greet the discussion and greet you all in this event. Before we start the discussion, here I will read Dr. Mehrunisa, PhD resumes. Her full name is Mehrunisa, and the title senior lecturer or doctor. She has academic qualification, Doctor of Philosophy in Medical and Health Sciences Parasitology in International Medical University on 2015. And she has in MSc in Medical Microbiology in University Sains Malaysia on 2010. And she has a qualification, academic qualification in BSc in Biotechnology in AEMST University on 2007. She has a professional membership on organization Malaysian Society of Parasitology and Tropical Medicine as assistant secretary on 2020 until currently, and Women in Science for the Developing World as an adopted council member on year 2020 until currently, and Malaysia Indian Education Development Association as a financial auditor on 2020 until currently. She has teaching activities, research methodology in the level Master in Applied Sciences, and she has a medical parasitology and entomology, basic microbiology, environmental microbiology, scientist communication, a level on degree, and parasitology, basic microbiology for environmental health as a diploma. And she has administrative responsibilities. She has post with chief editor for International Journal of Research in Pharmaceutical Sciences on year 2019 until currently, and moderator for Apple Committee on year 2020 until currently, and co-representative in MISTIC for Grant Review and Innovation Review Committee on year 2020 until currently. And the last FEP Diploma Coordinator on 2000 until currently. And the previous employment, a senior lecturer, employer Lincoln University College on Malaysia, and in year 2015 until 2016. And she has written 6 conference seminar and training last 3 years, and 3 research activities, 17 publication journals, and 15 conference proceeding and lab and lead researcher twice in 2016 and 2019. That's the resume of Dr. Mehrunisa, Doctor of Philosophy. Let's begin today's expert lecture. I invite Dr. Mehrunisa, Doctor of Philosophy.
Thank you so much for the introduction. Twina, what's your name again? Twinina, is it? Moderator, what's your name?
My name is Dea Winasari.
Twina, thank you so much. Thank you also to Ibu Dr. Lisa and Imam Ghazali for the introduction. Okay, I've not actually updated the CV. I have a latest one, but it's okay. We can go. Thank you so much for inviting me to share on tuberculosis. So before I go, I would like to say I'm basically a medical parasitologist and also a microbiologist. My research mainly on parasite. At the same time, I work with the Orang Asli in Malaysia, and we also do microbiology research and screening. Okay, so before I go, so what program are you all doing? There are around 100 plus here. Boleh tahu student buat program apa di ni? Di kat UNISA. What program are they doing? Biomedical science ke? Medic ke?
Medical laboratory technology, doctor.
Okay, MLT. So
Yes.
good. Because I have arranged the notes more suitable for medical laboratory technologies. Okay, so let me, all students are here.
Yes, mostly student, and Mrs. Lisa is responsible for bacteriology lecturer, and also me.
Okay, hello to your lecturer. Because I would like to have more to an interaction session. Okay, before I start, anyone here got TB before? Tuberculosis? You can raise up your hand dekat reaction box tu. Adakah sesiapa dapat tuberculosis dulu? I'm sure you all orang muda, 20 plus I assume. All of you all look young. Pernah dapat TB? COVID saya takkan tanya lah because ramai dah kena. Anyone got TB before? No, all very healthy. Congratulations. Good. Very healthy, students. Okay, let's go. I hope my voice is clear. So let's go. Let me share my slide. Okay, so slideshow. Okay. So I was thinking, because the title first was proposed on Gene Expert for TB. It's one of the latest technique I know, recommended by WHO and the beberapa institute at Meloguna. But we don't have the machine, but we do have the knowledge how it's run. It's actually basically macam guna idea PCR. So I keep it general, this topic. Maybe it's like a revision to you. Macam mana kita diagnose tuberculosis di peringkat lab, dan apakah lab testing yang kita boleh buat untuk mengenal pasti tuberculosis. If you see here, it's clearly shown that tuberculosis is a respiratory related microorganism, and it spreads from one person to another via droplets. Okay, so maybe I just... Okay, so you can see this. Just let me get this correct. Okay, it's interfering, so I just off. Okay, I think all of you can see. We'll move to the next slide. Okay, this is my lecture outline, how it's going to be. Okay, first we will start dengan introduksi, prevalence of TB worldwide, type of TB, exposure, vaccine and treatment, drugs for tuberculosis, basic microbiology, and also tuberculosis diagnostic. So this will be looking later. So I nak bermula dengan bercakap tentang tuberculosis. Okay. So let's go. So tuberculosis is a world leading infection. Okay. Tapi sebelum ni kurang kita dengar tentang tuberculosis because we past 3 years, semenjak 3 tahun yang lepas, kita punya fokus only on COVID. So we did not talk much about tuberculosis. Okay. Data dari World Health Organization menunjukkan bahawa in 2020, around 1.5 million people died of tuberculosis in low and middle income countries. Okay, so ini merupakan penyakit yang mudarat, penyakit kronik, progressive microbacterial infection, often with an asymptomatic latent period following initial infection. Ini bermakna bukan semua pesakit yang ada dijangkiti dengan penyakit TB akan immediately menunjukkan simptom-simptomnya. Tidak semesti. Even now, I can be a carrier. That means I'm having a latent infection, but I'm not showing symptoms. Okay? Atau students say you might be a carrier, but you are not showing symptoms. So we are called as asymptomatic. Mengapa kita tidak menunjukkan simptom? It can be because our immunity is strong. I tengok students sini ramai muda-muda. So your immune system are strong. You don't have a chronic disease and so on. Tapi, jikalau seseorang itu ada penyakit kronik macam cancer, they did organ transfer, diabetes, and so on. If they get latent infection, that means tuberculosis, immediately after a few days or months, they can have the symptoms. So this is tidak semestinya you tidak menunjukkan symptom, you are free from TB. Tak semestinya. Moving on, tuberculosis mainly they affect lungs. Symptomnya include macam a bit like COVID. You have cough, fever. You have weight loss, malaise. Malaise bermaksud badan. You feel very weak. Okay. So semenjak dulu, we mainly use sputum smear. I'm sure in UNISA also you are doing sputum smear and culture tests when available. But now we are using nucleic acid amplification tests iaitu dengan reference pada DNA bakteria itu untuk screening diagnose ada ke TB, tidak ada. Tak ada. Okay. Tapi memang di makmal still until now kita masih menggunakan sputum test for investigation followed by blood and so on. So far, am I okay? Am I clear?
Clear.
Thank you. Okay. Dengan treatment pula, there are few multiple antibiotic drugs is available to fight against TB, but you have to use dalam jangka masa yang panjang for around 4 to 6 months. Okay. So that is a very brief introduction. Okay. Looking at this screen, which did by David et al., there are few steps of TB progression. A person with active TB. Okay, bayangkan pesakit A ni, dia ada active TB. Active TB bermaksud bacteria is rapidly developing in the paru-paru, in the lungs here. So, bila orang ini go and socialize with a healthy person, but let's say dia healthy tapi dia orang tua. Orang tua and have weak immune system. A person with active TB and susceptible person can sufficiently get the transmission dari dia. How? Because you see jarak perbincangan dia, tak ada mask and so on. So the droplets can be transmitted. So increase contact rates. Once they get, you can see it's transmitted around here. The moment they get generation of infectious particles, more and more is generated around the infected person. So what happened? You proceed to step 3, which happened infection and disease progression. The moment pesakit ini merebakkan penyakit TB pada orang tua yang susceptible badannya, penyakit TB bakteria ni boleh membiak di paru-paru orang yang sihat. So, pesakit ini ada 2 kemungkinan. One, dia akan dapat latent TB kalau badan dia boleh fight back to the infection. Kedua, dia boleh jatuh sakit. That means confirm TB disease. Okay, that is a basic explanation about the disease progression. Okay, please feel free to unmute and ask me if you have any questions in between my lecture. Okay, let's start. Which day was declared World Tuberculosis Day? I have 1 or 2 questions in between my lectures, just to make it interesting. Anyone knows? Janganlah Google. What's the answer? Anyone wants to unmute and answer? Which was declared World Tuberculosis Day? Seluruh dunia, kita ni ada banyak hari. Hari Ibu, Hari Bapa, Hari Merdeka terpulang pada negara masing-masing lah. Kita ada Hari Ibu, Hari Valentine, Hari Bapa, Hari Tuberculosis, Hari Malaria, Hari Leprosis, and so on. Setiap penyakit kita ada hari dia. So which is for tuberculosis? Who wants to answer?
Hi, Miss.
Yes, please answer.
Option A.
Option A, very
24
good,
March.
very good. The answer is actually A. Okay, so 24 March every year, seluruh dunia akan celebrate or fulfill World Tuberculosis Day. Apakah kita akan buat hari ni? So usually kalau dekat Mestek, UNIKL, Universiti Kuala Lumpur, kita akan bagi ceramah untuk tuberculosis atau kita join dengan Kementerian Kesihatan untuk educate the community about tuberculosis and so on. So that is our approach. Okay. Name the causal organism that is responsible for TB. I'm sure you all have taken microbiology subject. Dalam bidang microbiology, kita ada bacteria, parasite, virology, mycology, fungus. So TB ini di kategori mana?
Bacteria, Miss.
Yes. Anyone cakap virus? Anyone support virus? Protozoa? No. So TB is a bacteria. Okay. Yes. Don't confuse it with fungal atau virus. Some before they come to the university, some they were thinking, oh, it's a virus TB, virus TB. It's a bacteria infection. Okay. TB affects adult only. Sokong atau tak ada sokong? Apakah pendapat anda?
False.
Option B.
B. False. Anyone say true?
No.
No. Why
No.
false? Because TB can infect children. They can infect teenagers, mid-teenagers can. So TB can infect all categories of human. Dari kecil hingga dari tua boleh infect. Okay. So that's okay, just some questions. Okay, now let's move on. So before we go to the other deeper topics, let's see how was the case of TB di seluruh dunia semenjak beberapa tahun lalu. Now we are in 2023. So how was around 9 and 8 years ago? So this statistic dari World Health Organization menunjukkan kadar perebakan TB di seluruh dunia. Kalau kita tengok, the graph was going up, up, up. 2019, 2020, a big fall in here. A big penerjunan yang sangat tajam di seluruh dunia. Adakah ini satu perkara yang menggembirakan? Or what do you think happened here? What happened in this period? If you recall back, 2019 December, we slowly had the Wuhan strain, COVID strain was reported. Okay, so 2020, almost all the world, we had the lockdown. In Malaysia, Indonesia, Southeast Asian country, in Western country, kita sudah ada lockdown berperingkat. So bila you dah ada lockdown, the communication between human went very down. So the spread of the disease also went down because of COVID. Second thing, bukan saja case we can confidently say, okay, case dah turun. Kemungkinan kedua, we stop screening for TB. Usually di klinik kesihatan masing-masing ada check TB, tapi masa COVID semua stop. We only focus on COVID. So it could be case tidak di-report dengan betul. So this is possibility. Okay. The same thing we saw in all the regions of the country. Southeast Asia, where we, Malaysia, Indonesia are there. A sharp drop. Western Pacific, a sharp drop during COVID time. Mediterranean region, Americas, European region, Africa. The only thing that Africa it dropped, but after that mid of lockdown they went up. Could be they start their screening earlier. But all the countries around the world, they had the same trend. Two possibilities. One, because of the lockdown, the communication between human and socializing was down. Kemungkinan kedua is seluruh negara hanya fokus pada COVID-19. So less screening untuk TB. Setengah orang dia ada TB tapi tak ada symptoms. So you assume they are negative. Okay. So let's look of type of TB. This is very basic, because when you look at TB disease, they also have active, inactive, and so on. Latent TB infection, or we call it LTBI. A next category is the TB disease itself. LTBI happens when kita ada bacteria dia di body, but they do not make you sick. Bermaksud, your immune system doesn't fight a lot. Could fight it and kill, and there are some very minimum infection there in your body, but you can withstand it. Your lungs are strong. Usually in orang muda, they are strong and their body is able to fight the bacteria. So ini merupakan simptom-simptom dia. You don't feel sick. The good thing, sesiapa ada LTBI, tak boleh spread bacteria to others. For example, all of you are college students, right? If your college dalam kamar, in your hostel, your friend has TB, he or she would not spread to you. And usually has a positive TB skin reaction or positive TB blood. So you only know they are positive by looking at their skin test or blood test. So that is something about that. Another type of TB is, we call it the active TB. Di case active TB, seseorang badan manusia tidak boleh fight, tak boleh resist with the actively growing bacteria. So we confirm this person have a TB disease. How do we know? By the lab test results. And they have symptoms, which include bad cough for 3 weeks, sakit dada, kahak dia ada blood, or saliva dia, sputum dia ada blood, weight loss, and fatigue or weakness. So this is one of the very good symptoms of TB. Secondly is by looking at the X-ray. Usually doctor will ask, okay, go and take your X-ray. We will look how clear is your lungs. those who have a very bad TB, you can see their X-ray in a smear sheet. So we know this person is actually positive for TB. Okay, this is cara-cara diagnosis here. Okay, let's try now. What are the symptoms of people suffering from latent TB infection? Anyone wants to give a try? Latent TB.
Option A is.
Okay, anyone else?
A, Miss.
Okay, everyone have A. We just talk about this. So, sesiapa ada latent infection tuberculosis, they would not have symptoms. So, if they feel sick, they're able to spread bacteria to others, or have a negative blood test, they should not be considered as a latent. Because latent TB, they still will have a positive results in their skin test. Okay. Exposure to tuberculosis. So, it is important to know that a person who's exposed to tuberculosis bacteria, you won't be able to spread the bacteria to other people right away. Okay, so only a person with active TB can spread bacteria to others. Assume warga ni adalah pesakit TB, tapi bukan aktif. If they are in our kalangan, come to socialize class, tak pakai mask, they won't be able to spread. But if the person already showing symptoms of TB, the amount of the bacteria is high in their lungs, there are very high chances for them to spread TB around. At this point, you could possibly spread active TB to others. People with TB disease are most likely to spread the bacteria to other people as they spend time every day. So when you have TB, so family, friends can be affected, friends, co-workers, schoolmates, and so on. Okay, so this is why we said, if you have TB, we have to isolate you. Kita put you in a special room, telling you stay isolated, and the nurse who wants to give you medicine and so on, they use their PPE, or even at certain stage, you are at home, you are advised to be isolated from the family members. Okay, so this is something related to exposure to TB. Okay, so saline TB, please let me know what are the diseases having the same concept, spreading to others by droplets. Can you all share with me something that you know?
COVID.
Good. COVID is a virus. The same thing. Saline COVID. Any other bacterial disease? What about pneumonia? So P pneumonia, streptococcal pneumonia, that is actually they cause pneumonia in your lungs. They also related to something like TB. They are also respiratory disease. So all these infects your respiratory system, lungs, and so on. Okay. And bila berkaitan dengan paru-paru, immediately you need treatment. Because kalau imagine, kalau bacteria itu giving infect to usus, bakteria usus. Seseorang yang ada penyakit usus disebabkan bakteria, the chances of them, of us, selamatkan dia lebih tinggi dari seorang yang ada infection di paru-paru. Because you know, paru-paru you need to breathe. Every seconds you're breathing. If that is disrupt, your whole function will disrupt. Usus is still okay because you need immediate action also, but not as so critical as this. Higher survivability is there in usus. Like say you are infected with Shigella flexneri, bloody diarrhea. What else do you know? Cholera, the bacteria that causes cholera. You have dysentery. So if you could admit the patient, maybe after one day they're at home, they come to you and saying non-stop diarrhea, you give saline and some antibiotic, dia boleh diselamatkan. So tuberculosis and like COVID, penyakit yang infect the paru-paru. If your body is strong, yes, you can fight back. But golongan tua, immunocompromised patient, children, they won't be able to fight back. So that is something about respiratory disease. Okay. Do we have a vaccine for TB? Yes. Okay. It's called the BCG. In Malaysia, usually when they are child, when you're a baby, you're given BCG. In school also, we have a BCG. The full name for BCG is Bacilli Calamantin Guarin. We just call it a BCG. Ini nama scientist, yeah. I'm sure in Indonesia also, the government is giving you a BCG vaccine. I believe so. Okay. So, aside from vaccine, we also do have treatments for TB. We have Rifina, various preparation, Oractin tablets, and so on. So, when we look at drug preparation, okay, kita ada campuran Rimfampicin, isoniazid. These are commonly used untuk TB. Okay. Tapi now we dah ada strain yang resistant pada TB drugs. So this is still commonly used. Rimfampicin plus isoniazid. 300 of this, 150. Or you have Rimfampicin 150, isoniazid 100. All these are different combination. So this will depend on how the clinician decides to give. And the treatment for TB, the guideline you have to refer to the each country's guideline. The health ministry will set the drug dosage for each country. So far, all okay? Good? Is it clear?
Clear, Miss.
Very clear, Miss.
My English is okay?
Yes.
Okay,
Yes.
that's good to hear. Okay, in between I'll use a local language also. So this is the various combination. So ini terpulanglah pada negara masing-masing how the ministry has set up. Depends on the country's case. Okay. So this is important to focus untuk ramification sini, because the gene expert, which I'm going to explain in the last slide, okay, gene expert instrument has the ability to detect resistant ramification bacteria. Ramification bacteria, which is tuberculosis, resistant to ramification, can be detected using gene expert. Why? Because these are the drugs they used. So the machine is designed to detect this strain. Okay. Let us look on category of drug-resistant TB. The degree of drug resistance varies, and different types of drug resistant are monodrug resistant TB, resistant to one TB drug. Bermaksud kita ada banyak medicine di sini, rimicin, isoniazid, what else you have? Pyrazinamide. So how they are resistant, we can categorize this. Jikalau kita bercakap mono means bacteria strain ini hanya resistant pada sejenis ubat. Second, multi-drug resistant. It means strain ini resistant lebih dari satu ubat. It can be rimicin, isoniazid, and so on. Yes. And the most headache and our concern is on the XDR-TB. That means strain yang resistant to various drugs or resistant fluoroquinolone or any drugs which are injectable. So this is how we categorize on drug-resistant TB. I'm sure in your microbiology lesson, you have learned about MRSA, which is still happening, multi-drug-resistant MRSA, Staphylococcus aureus, and so on. So TB, we have some issues on drug-resistant occurring. But if we can bring the TB case down, then we can actually take control of the drug use and so on. Okay, so kita dah cakap banyak about tuberculosis. Now let's see what bacteria causes tuberculosis. Okay, so let's see what is microbacteria. So nicely we are saying, oh, TB. Then you know it's a bacteria. But let's explore a bit about the history or ciri-ciri basic microbiology on microbacteria. Okay. Microbacteria is a gram-positive. Okay. What do you mean by gram-positive? Who can tell me? What results you get in your gram staining? If gram-positive. Okay, what is the first stain in gram staining? What is your first stain in gram staining? Is it carbon fusion?
Crystal violet. It's a crystal violet, Miss.
Is it a crystal violet? Is it a saffronin? Is it a methylene? It is a crystal violet.
Yes.
Okay, so if gram positive, what color will they be?
Violet, Miss.
They are pink reddish kan? Because they will retain the crystal violet. If gram negative, they gram positive, they'll be purple color. They manage to retain the crystal violet. If gram negative, what color they will be?
Red.
Pinkish red. Because they manage to retain the safranin color in your gram staining. Okay, so I'm just asking about gram staining. But the stain that we use for microbacterium is actually an acid-fast stain. We'll be looking later on in the lecture. Okay. Microbacterium are gram-positive, catalase-positive. This is under biochemistry test. Non-motile. So kalau we put the bacteria in motility reagent, non-motile. No spore forming rod-shaped bacteria around 0.2 to 0.6 micron. See, non-spore forming rod-shaped. So how do you think they spread if they are not spore? Bacillus subtilis is a spore bacteria. So they are spread because of droplets only. Bakteria yang ada bentuk spore, dia cepat merebak. Bacillus subtilis yang guna ada case anthrax, lebih cepat. Kalau non-spore, for this, they usually by droplets. The cell wall of microbacteria are tebal, very thick, and they consist of 4 layer. Tebal tu, 4. The innermost, very innermost is called peptidoglycan, and dia ada lipid. The presence of lipid, lipid is actually lemak. The presence of lipid provides the bacteria with resistance to acid and alkaline environment and renders the cell relatively impermeable to various dyes, which need to combine with phenol to allow penetration to the cell wall. Okay, so ini merupakan penjelasan mengapa we don't use gram staining untuk Microbacterium tuberculosis. Sebabnya, bakteria ini ada lapisan lemak, which is lipid, very tebal. So what happened? Any dye, dakwat yang you nak bubur, nak stain, they will be able to resist. So just why we use a special stain we call carbon fusion. Clinically, the most important species we call it Microbacterium tuberculosis. Tapi we actually have many species of tuberculosis. I think someone's one is unmuted. Please mute. Good, thank you. Okay, if we see kita ada banyak species yang important selain Microbacterium tuberculosis. Sebab Microbacterium tuberculosis ni famous because they cause tuberculosis di manusia. Padahal kita juga ada jenis-jenis Microbacterium lain yang boleh menyebabkan penyakit TB di veterinary side, like cattle. We have Microbacterium bovis. Then some area in Africa, you call it Microbacterium africanum, and so on. So, bila kita bercakap about penyakit TB, you must be very clear, kita ada banyak jenis. And jenis-jenis ini, species and jenis, dia datang dari spesies yang sama, Microbacterium, tapi genus is different. Okay, so when kita buat genetic screening, kita boleh buat sequencing and see which species are they. Okay, so the most important one clinically, which is reported worldwide, is the Microbacterium tuberculosis. Okay, so this is a picture of how the Microbacterium tuberculosis looks like. A cartoonic image on how does it look. Okay. So it has a rod shape. And this is a rod shape. They need oxygen. They're aerobes. They have mycolic acid, bahagian lemak. 1, 2, 3, 4. You can see 4 different kind of layers. Okay. This is why we need some gram staining, a bit difficult to see them. But what we need a stain that can penetrate into the cell wall to show the color and so on. So what we use is Ziehl-Neelsen stain. Okay, so far? Yes. So this is a cartoonic favor. Okay. So before I'll give you 5-minute break. We can take 5-minute break later. Okay, so this is the cartoonic shape. So the second part, we will go deeper into all the diagnosis. So before that, I would just like to share how in University Kuala Lumpur, we did this in November 2022, yeah, last year. We did community surveillance for TB in Orang Asli with the Ministry of Health Malaysia. So some of my students participated. I'm not sure if today they might be here in the Zoom. I invited them. So what we did, we went and did the screening for the Orang Asli community. So just a brief introduction. Orang Asli adalah community indigenous di Malaysia. Dalam zaman purba lah, they are already orang yang first come and settled in Malaysia. Mereka perkampungan mereka dekat kawasan hutan, very deep, and also di Malaysia they have the highest infection of parasite disease, and sometimes they are prone to diseases, and they are also quite poor, the community. So let's see how they did this particular village. But we go with the Ministry of Health Malaysia lah. They do have the campaign TB. Sebab orang asli, for them to come to hospital is a bit difficult. Sebab mereka duduk dalam kawasan yang pedalaman, and transport susah nak datang. So kita pergi ke tempat mereka. Like for us, what we do is like I directly go to clinics and so on. Okay, let's have a look. Okay, so this is what we do. Okay, on that particular day, even unit ada setengah unit datang check gigi semualah. So these are my students. They are all biomedical science student. Biomedical science, something like degree in MLT lah in Malaysia. So we go, this is the doctor in charge for the TB. This is me. So we went to the village, they bagi briefing. So half pergi ke perkampungan di bahagian selatan, half pergi ke di bahagian utara. So ini merupakan aktiviti lah. So kita kena pergi rumah ke rumah, and kita tanya anyone in the house ada history TB, penyakit diabetes, sebab seorang yang ada penyakit diabetes, kalau dapat TB, it's quite serious for them. Okay, they are immunocompromised patient. Okay. So bila kita bertanya, kita jangan directly we ask, oh ada TB ke tak? No. We ask dengan, adakah semenjak beberapa minggu ke 1 month ada orang kahak ke, jatuh sakit and all this. Then kita bagi sputum bottle. You can see the student lah. This by volunteer. Except case yang dah kenal pasti ada TB, we just follow up. Yang ni kita tanya kalau dia nak bagi sampel. We don't paksa. So we use this one lah. They are also MLT students, but we use the yellow bottle and biohazard bag. Because it's also dangerous for us to handle. So this is how we do. Okay. So this is all the posters, community education. And they did the staining. So this staining did by the health ministry. We used Oramine or stain kit. This I don't use in my teaching because this is a fluorescent. But currently in Malaysian clinic hospitals, they use this Oramine or stain kit, the fluorescent stain kit to do field sampling. That means just belakang surau ni kita pinjam. Ini tidak perlukan Bunsen burner. You don't need to heat it. Directly you can stain and wash dengan air suling. Slide dia boleh disimpan and you read under fluorescent microscope. If I'm not mistaken, it's a fluorescent microscope. So this is the latest staining procedure used by KKM here. And we did find one latent TB case lah. Tapi dia dah beritahu lah. She's under medication and so on. So of course, the orang asli photos I cannot display here of confidentiality. But we did have one latent TB and also a few cases of the patient having symptoms and so on. So this is the field work. You can see there are actually more deeper houses here, but they're actually poor community who living near the fringes of forest. So for them to come to the hospitals is a big problem. Not all of them have the vehicles. Okay. So shall we take a 5 minutes break, moderator? Then we will move on to all the diagnostic work. Diagnostic tests I will explain in another 1 hour. Are you okay? Aiman or Twilina?
Yes.
Okay,
Okay, Miss.
take 5. We'll meet again here. Okay, we can continue. All good?
Okay, Dr. Nisa, can continue now.
Okay, good. Let me share my screen. Okay, so now we will look in the diagnosis method. Okay, I started first explaining about introduction of TB. Then kita belajar tentang how it transmit to others. Ubat, vaksin untuk TB. What else did you learn? You learn basic microbiology for TB, tuberculosis. And now we are going to the main part, which is what are the different methods that you have or we can use to diagnose TB. Okay. Tuberculosis diagnosis. Simply put, if we cannot find TB, you cannot treat TB. And we cannot treat TB, we cannot find TB, and we cannot end TB. Simple. Simple as that. This is the real issue about TB. Why people are asked, why it has been 2023, why can't we eradicate TB like how you eradicate the smallpox? The issue is we have issue in proper diagnostic of TB. From the beginning, students and participants, TB was diagnosed based on smear and culture. That was our golden standard method. Classical method is actually microscopy. Smear and culture. But over the years, we find these two methods is not efficient untuk detect TB. Tak berefikasi. Let's see. So, ini merupakan dari Madura Pai et al. Publication, latest publication. Author ini, researcher ini telah menyenaraikan apakah teknik-teknik dulu kala atau sekarang masih kita guna and what is the recommended or how we are slowly going into TB diagnosis untuk close the diagnostic gap. Diagnostic gap bermaksud how do I say this? Patient sakit. Okay, patient sakit. Bila patient di ward sakit, so imagine patient di ward sakit dah tunjuk simptom-simptom bacteria infection untuk TB. So the doctor, okay, I might want to test the patient. So he take the sputum. Okay, just take the sputum first. Then pass to the MLT lab. So you are there, you are graduate, so you will be working there. So just imagine if your microscopy technique could not detect very less bacteremia. Bermaksud dia ada TB tapi kuantiti TB dia sangat kurang dan tidak boleh didetect dengan mikroskopi. ELISA buat tak detect. So what they will do? Doktor kata, oh ini biasa, mungkin pasal cuaca and so on. So that's why we call is a diagnostic gap. Patient ada tapi the teknik yang kita guna ni tidak cukup untuk mendetek dia ni positif untuk penyakit TB. Okay. So, semenjak 10 tahun kebelakangan ini, dari teknik mikroskopi, slowly we are moving to molecular. So, this is where you have your gene expert instrument coming in. And molecular is good because you can also detect the rhamnophycin resistant strain of TB. The only issue is expensive. Centralized lab-based NAAT. NAAT is actually nucleic acid detection method lah, which is also like PCR based on DNA. Centralized lab. Dulu kala some places dia only ada makmal induk yang buat PCR. Makmal lain just buat smear-smear. Sekarang semua lab dia kita bagi PCR machine. Decentralized dia. Tak payah semua hantar ke makmal induk. Semua makmal kecil mesti ada staff untuk buat PCR screening for TB. Single test disease, multi-testing disease. Dulu we just take one blood sample, we test. Now no. Blood, sputum, urine, everything we test and test the patient whether you're positive or not. Sputum, we target only sputum. Now we can also say oral swab, urine swab, and so on, and do the smear. The reason is, sometimes bila patient bagi sample sputum, dia the bacteria is there tapi dalam inside dia paru-paru tak dinampak. I can share my experience. When I did my training in the hospital, after my undergraduate, I was trained, I buat internship dekat hospital. Hospital dekat kawasan, hospital induk, tapi hospital kesihatan. So I dapat sampel sputum dari banduan penjara. Banduan penjara, my place in Taiping, Perak, in Malaysia. So we terima banyak sampel dari banduan penjara because we have TB cases in the penjara. Because penjara dekat one cell, dekat one kamar penjara tu bukan satu orang saja. Dia akan bubuh a few inmates in one room. Unless dia case yang sangat serious macam murder case or they are emotionally unstable, then satu banduan penjara akan dapat one cell. I hope you getting what I'm saying. Satu kamar. Tapi yang ni kalau macam just case-case yang bukan berat, dia akan campurkan beberapa banduan penjara dalam satu kamar. So what they do, they started to get TB and spread. So my experience, bila I buat one specimen, negative. Then I will tunjuk to my supervisor, oh, negative. So what we do, we take the following week a few sample, tengok-tengok dia positive. So that is the limitation about sputum sample. Another thing, another method we have improvised in TB diagnostic, healthcare facility-based passive care screening to closer communities and homes active pre-care screening. Seeking. Healthcare facilities. Those days, we only have the main hospital who does the patient care and seeking. Nowadays, tidak. Kita ada klinik-klinik community dekat perkampungan. For example, I took my student and went. That is one, we call it community-based approach. We go to their house. We talk about TB. We do awareness program because many doesn't know about this infection because nobody talks to them in the rural area. So we do with the students. Focus on test accuracy. Focus yield on population coverage. Dulu kita just focus, okay, I buat test ni, accurate tak ada ke tak. But nowadays, we are taking from many population. Let's say patient X dah TB positive. So what I will do nowadays, we go back to the patient X. Kita tanya beberapa orang yang close contact dengan you. Either your family members, your working colleague, all of them we call. We do the skin test to see whether they are positive or they are carrier and so on. Because if they are latent TB, they won't show symptoms. We also had students outbreak, TB outbreak in Malaysia a few years ago, before COVID, in Sekolah Asrama. We had that. Okay. And previously we had high cost, low volume and high impact manufactured. Now kita pergi ke low cost system tapi boleh run a high volume samples and low middle country manufacture. Those days your machines we buy from the a high income country, you know, because we don't produce here. Nowadays we don't focus that. High income countries usually machine dari negara barat. Nowadays no. If we can get any machines nearby country which is accurate, we will just proceed. That is all the transition that has been happening mainly for TB. So that's why now things are good because we can screen even the latent TB effectively. The only thing we need the patient's commitment untuk datang screen. So apa kita boleh buat? Awareness lah. You go, you talk about TB, awareness to people, and you'll be surprised, you know. Even though we are in 2023, you'll be surprised, students. Many people in community, they don't know about TB. Now everyone know about COVID lah, but TB ramai tak tahu lagi. Oh, ini batuk sajalah. Oh, ini mungkin sakit apalah like that. But it's actually TB. Okay, let's start with our very first classical technique, which is sputum smear detection. This technique I still use to teach my student. For us, when I'm teaching MLT and biomedical science student, we still teach the classical technique. I'm sure you're also learning the same thing. But only thing now is we have a limitation because for this you need biosafety level 3, biosafety cabinet level 3. We have 2. So what we do, the microscope, the staff, our lab staff, they akan fix bacteria untuk student. Student hanya buat staining. Sebab we don't have enough biosafety, we don't have biosafety level 3 untuk bagi semua student guna sendiri. So they mainly focus on staining because TB is very dangerous. You cannot do it macam gram staining. I'm sure bacteria, you use the bacteria macam E. coli, you stain crystal violet, iodine, acid alcohol, safrani, D-major. And also you fix the bacteria D-major. It's okay, it's not dangerous. But TB, you cannot do that. You need to do under the biosafety cabinet. But after you heat fix, you can do the staining on the table. That is okay, no problem. Okay, let's see. What are the issue with microscope? However, microscope has little limitation, including low sensitivity and inability to detect drug resistance. Microscope underperforms in people co-infected with TB and HIV. So these are all things you cannot detect in microscope. And it requires a complex system and quality assurance of preference. That means you must have a good trained microscopist di bidang TB. Sebab dia mata dia kena able to tengok bahagian-bahagian yang rod shape yang pinkish. Kalau penglihatan dia tak baik, then it can be a false negative or false positive results. Okay. So this is how we do. We collect the sputum. And like for us, we receive in the urine bottle, sputum bottle. And we do the smear. But the heat fixing is only in biosafety level 3. Once you the heat fix, you bring into the bench and we do staining. Okay, as we know, TB bacteria, they have a thick mycolic acid. So what we have to do, we cannot use the gram staining technique. We use carbon fusion. This is red in color. It looks something like the hospital smell when you burn it. carbon fusion and this particular stain you kena panaskan dia. Either you direct panas bawah atau you guna a beaker, steam. Then you apply a acid alcohol decolorizer. Then last but not least, we apply methylene blue as a background, modern, just as a background. So kalau dia acid fast stain, it will be pinkish color. This is how we have it. Okay. So I will share the video that I've taken with my lab here. How do I do this? I think you all can see, right? Yeah. Okay. Okay. So student, the bacteria is here. We already heat fix in the biosafety cabinet. That one I'm not able to take photo lah because it has to be very sterile and we can't touch. So we heat fix the bacteria. So you might ask from where that you might be nak tanya kan dari mana kita dapat bakteria. Actually dekat University Kuala Lumpur kita ada culture. We are growing the TB bacteria lah dalam media. Kita memang grow dia lah untuk pengajaran pelajar. Okay, dah heat fix you know kan guna Bunsen burner. Kita panaskan di bawah tapi dalam biosafety cabinet. Staining I'm doing outside. If you see students, this one, I did not do like, okay, I did not put the beaker because first we have many samples actually. So this is why we find easier. Even our hospitals here in the government, we just heat directly with the Bunsen burner down, but we don't boil it. Okay. So you might be hearing some kick noise. The background noise is actually the other side of the lab. They are doing bacteria colony counter. So sorry about that. I couldn't avoid. Okay, so that is something about the acid-fast stain. And we will able to see the results as what I display here. So this is what we observe. But there are always challenges even for us. At times the bacteria don't grow actively, we culture and so on. So when we take out from the medium, when we are culturing, actually we culture with saliva. I'll talk about the medium later. Okay, now let's go about the second one. So in each lab, we can actually optimize the timing that you want to do the stain according to the quality and the, how do I say, the viscosity of the stain that you are purchasing. Because in my experience, the carbon fusion, the Ziehl-Neelsen stain that we use here, Ziehl-Neelsen is the name of the scientific, the right name we use carbon fusion, or we call it Ziehl-Neelsen stain. At times, certain company you buy, for example, here in locally, we have Sigma Aldrich, which is very expensive. We don't use that. That stain will be good. But if you buy from some local meat companies, it don't stain it properly. Very light color when you put acid alcohol. So what we do, saya akan meningkatkan masa Ziehl-Neelsen itu. Maybe I put around 10 minutes or longer. And I washed it off a bit rapidly and so on. Okay, let's look the second one, which is the TB culture. So TB culture is also a classical method of diagnosis TB. So how you do? In this test, your sample, saliva sample is taken to the lab and put in a special medium. We call that LJ medium. So in University Mestek, Kuala Lumpur, kita growing the bacteria in LJ medium, and AFB culture can positively confirm a diagnostic for TB, but it takes around 6 to 8 weeks to grow. Tapi yang ni ambil around 2 bulan lah untuk grow di TB culture. Okay, the LJ medium, the scientific name we call it, the real name is Lausten-Jensen medium, or commonly known as LJ medium. This is a specific selective media for Mycobacterium tuberculosis. Selective media. So this media you need to prepare. I'm not sure commercially available or not, but the lab staff, they prepare, they use a few components to prepare this LJ media. Okay, so this is how it looks like. LJ media ni warna dia hijau. Control, negative, positive. Control yang tidak ada sampel saliva. Negative yang dicampur dengan sampel saliva, and positive. So ini bermaksud patient yang ini negatif untuk TB, patient yang ini pula positif untuk TB. Because when it grows, the TB, there will be some color changes. There will be yellowish color. So this one, we cannot open it in the room. We only open it under biosafety cabinet. Okay. Third pula. So third, what we do is the TB skin test. TB skin test, yes, it is still done, but according to the health ministries and also scientists, this is getting less sensitive. Less sensitive. Okay, TB skin test is called Mentox. It's the name of a scientist. Tuberculosis skin test or TST. We just said skin test. So ini akan ambil masa yang lambat sikit sebab on the first visit, the doctor will inject a small amount of fluid, we call it tubulin, antibody on the skin, and second visit baru kita akan ukur the reaction. A person given to the tubulin skin test must return the second day or the third day, 48 hours to 72 hours, and to have a trained healthcare specialist. Okay, so you really need an expertise who already well trained how to read your reaction di tangan, your arm. So the result depends on the size and hand area and swelling. Okay. So difference between positive and negative. So what happens on the day you come? They will inject, we call it PPD or tuberculin here until the dermis. Okay, then we tell the patient balik dulu. You datang ada dalam 2 hari atau 3 hari, we will see. Okay. So apakah logic behind the reaction or what is the application? Okay, kita tahu di badan seseorang yang ada positif TB, mestinya kita ada antigen. Antigen dari bakteria, Mycobacterium tuberculosis. So bila kita inject this tubulin, this injection, something like an antibody, dia akan ada reaction. Kalau you ada antigen, you akan react. So then you have some swelling here. And they measure it. If it's positive. If the patient is negative, you don't see any changes. Range ini depends on KKM lah, Kementerian Kesihatan, what they, that particular clinic said. To know the exact one, I won't be able to give now what is exactly they mentioned, because at times the range is different, the range of the reading. But usually, if the patient has negative, you don't see any swelling. So what is the issue with this? Why nowadays, what I heard lately in our hospital setting here, they don't prefer this. The doctor to infectious disease, they don't like this method much because it's not accurate. Why not accurate? Okay, bayangkan this patient tak ada TB, tapi dia dah terima vaksin BCG. That means vaksin BCG ada lagi dalam darah dia. Bila vaksin, you know vaccine is actually antigen, right? Inactivated vaccine. So bila masih, like for me, even I received BCG already twice. Bila dia ada di dalam badan kita, bila you buat antibody, mesti dia akan show some reaction. So it is quite confusing if the patient already had the BCG vaccine. So what you have to do? You have to reconfirm them either with culture, what else? Sputum, ELISA, which is blood smear, blood culture, and PCR. So that is a bit confusing. Skin test, as I know, in Malaysia, very less they are relying in, unless you have a close contact. Close contact, then they might ask. They're still depending on the sputum. Next. TB, the next diagnostic is TB blood test. This is quite accurate, TB blood test, or we also call it interferon gamma release assay, or IGRA. This quantiferon TB Gold QFT is a simple blood test that aids detection of Mycobacterium tuberculosis. So what is IQF? It's actually an interferon gamma. You know, in your immune system, you have interferon gamma, you have beta, all this. Release assay, commonly known as IGR, is a modern technique alternate to tuberculin skin test. So this assay can replace the skin test, which is not so accurate in showing the results. So what is the idea behind this? When your body is infected with certain infection, for example, TB, interferon gamma will be elevated in the blood. And marker, kita ada marker macam interferon gamma and so on. Marker ini boleh diguna untuk detect TB. Okay. So macam mana cara dia? IGRB test. Doctor and nurse, we will draw the blood collection. We will mix the tube and we'll add some reagents. There are some reagents to add here. And we do a ELISA. ELISA ini diguna untuk detect presence of interferon gamma. If a patient is infected, this akan naik. So this is another method. So from first, we only take sputum. So yang ni bukan invasive ya, just sputum untuk smear. Sputum, TB culture, this also not invasive. You culture actually your sputum sahaja. Kita tak guna darah. Then we went slowly to the skin. Tak invasive, kita pergi slowly to the skin. This also in the derma. Then now we go into invasive, which is taking the blood. Now we are going slowly deeper and deeper. So if you ask me, blood test is actually accurate. This is quite accurate. What do you think is the issue with this? The ELISA kit is expensive. Nak detect interferon gamma, IGRA, specific untuk TB test is mahal. Secondly, you kena need the software to read the data. You perlukan kepakaran untuk menginterpretasikan the data, yang mana background reading, graph naik macam mana. So the staff kena ada training betul-betul. And of course, bila we deal dengan pipette, all these things, it should be very sterile. Sputum is very easy. Sputum test, you put in microscope, you put oil, it's easier to observe. But when you are going to test kit, this you really need a proper trained personnel to handle this. So that is the difference. But this is accurate. Yes, this is good. Okay. So last but not least, now we come to the nucleic acid part. Having said that, we are all looking into nucleic acid. Yes, even WHO now are currently recommending of using nucleic acid amplification tests for TB diagnosis. If you remember, when COVID was first diagnosed, we were actually doing the swab test, but then you had to use the real-time PCR assay to study the various strain. Is it COVID ni strain beta ke, gamma ke, which strain? You have to use the real-time. In TB, this is a technique mainly to use to detect DNA of Mycobacterium tuberculosis dalam sputum atau respiratory sample. The reason why we came with NATT amplification, because they only need very little sample. Sputum sample you kena bagi betul-betul. You need at least a few mil, because you really need to make sure the bacteria is there and so on. This one, you just need little, as you know, DNA, and it can amplify the genetic material. So nucleic acid amplification test, which based on nucleic acid DNA. So we use the PCR method lah. Common, as what it was spoken. Gene expert is one of the latest technique. Latest, but even though it has been the market for a few years, students, that is used to actually detect Mycobacterium tuberculosis. So what is...
Sorry for interrupting, Dr. Nisa.
Yes.
But your time is 10 minutes left.
Okay, sure. I'm finishing it ready.
Okay.
Thank you so much. So what is so special about gene expert? Bukan saja untuk detect, tapi ada dua fungsi. Satu, dia boleh detect various complex strain of Mycobacterium tuberculosis. Secondly, bila you run machine ini, you boleh detect riboflavin resistant. Now remember the drug that you're using, gene directly on spot. Okay. So it's an innovative tool, prompt to MTB drug resistant. Attractive point of care, that means on spot you can do. And dalam lingkungan 2 jam, you can get results, whether the patient positive atau negative. Very sensitive and specific. Gene expert MTB. So bagaimana kita cara buat dia? This is the machine, tapi machine ni kena beli spesifik untuk ni. We cannot use our own PCR machine, cannot. So the only the weakness of this technique is mahal. Bukan semua makmal mampu. Kita ambil sputum and mix dengan reagent. Kita ada one special reagent for this. Bila dah campur reagent dekat sputum, we put in the cartridge. Ini macam printer ink lah, you know, our printer ink cartridge, and you masukkan saja dalam mesin. The machine ini, dia akan actually ambil sputum sample. You tak payah extract DNA pun. By ultrasonic lysis, they will do all the work. They actually detect the DNA. They'll mix with the PCR reagent, and they do a semi-nested real-time PCR. It's actually a real-time PCR lah. So we call it semi-nested because dia akan detect resistant strain dulu, resistant strain plus positive strain for TB. Dia boleh detect. For example, MTB detected low, dah low, RFI resistant not detected. That means bermaksud patient ni positive. So very fast, you'll get the result 1 hour 45 minutes. If you can recall back, this is the same concept yang kita buat serology testing. You know your lipid profile, you take your blood, serum you hantar to serology machine, they'll get the reading. Albumin tinggi, lipid tinggi, and so on. So this is actually the latest technique, very accurate, good, recommended by WHO and CDC. Can be used in a lab which is actively screening for TB. But in our university, we don't have the machine because we are teaching university. We are not a servicing lab. But this is a good way to go. I think with that, my talk has come to an end. Thank you once again. I hope with this, we will go out. Knowledge should not be kept to us. Please share the knowledge with others. Stop TB and save everyone. Thank you so much.
Okay, thank you very much for Dr. Nisa to deliver the outstanding lecture today. This is the very interesting topic. We also think that tuberculosis is one of an emerging burden health issues worldwide. So right now we move into
Okay, before that, maybe can I ask a random question? How serious
yes.
is tuberculosis in Indonesia? Because in Malaysia, it's not that issue yet because it's under control. The government are really controlling. If anyone have TB, immediately you give treatment. So how serious is this TB in Indonesia perspective?
In Indonesia, TB is according to WHO data, Indonesia is the best three.
Oh, that's good.
Yeah, it's the best three for TB worldwide. Below India and after Indonesia, there are China. So in Indonesia, TB is the most infectious disease right now.
I see. Okay,
Yes.
okay. So I hope
There are
then this will
also
help. Okay.
yes, there are also many challenges in fighting against TB.
So
Okay,
I
Dr.
believe
Nisa,
community education is one of the way forward. No?
Yeah,
That's my
right. Yes,
recommendation.
right.
Okay, thank you.
Okay, right now, student, we move into a question and answer section. Because of the limit time, we
Yes, I
open
understand you
for
have your Friday prayers, right, today?
yes, we open for 3 questions. You can type your question by chat box, or you can raise your hand and then open your microphone. Okay.
Yes, please do ask. But I might need a help to translate if I don't understand the question.
Okay.
You may ask in Bahasa Indonesia, no issue.
Yes.
Please proceed.
Bisa pakai bahasa Indonesia, silahkan nanti kita bantu untuk translate ke Dokter Nisa. Silahkan teman-teman.
Any questions? All very clear.
Any question, student? Bisa bertanya langsung ke bahasa Indonesia, silahkan. Kalau ada yang mau ditanyakan tentang TB dan diagnosa TB.
I see Imam Ghazali raised his hand.
Okay, my name is Imam Ghazali. I'm trying to ask in Bahasa in English. Okay. There are people who will not check their health condition when they don't feel sick. Meanwhile, in the latent infection, one of the symptoms is suffer can feel sick. I just wonder how long the bacteria will stay in our body without medicine or antibiotic therapy. And at the drug resistant, is there more morphology change when we look at the electron microscope or there isn't? Mungkin Ibu bisa bantu.
Okay, thank you so much,
Translate.
Ghazali, for the interesting question. Okay, so Imam Ghazali, dia bertanya 2 soalan ya, I think. So one is if patients yang tak check body, they don't check their health, will they know they have the bacteria? Am I right? Yeah. Secondly, dalam strain TB yang resistant, bolehkah kita nampak changes di permukaan TB bacteria di scanning electron microscope? Okay, so let me address the first question. Okay, bila seseorang tidak menunjukkan any symptoms, so usually we assume kita free TB. Okay, tapi dia boleh carry the TB as a carrier, latent TB, as I was explaining in the lecture note. We call it latent TB. The patient, kalau dia orang yang sihat, Kalau dia ada latent TB di tubuh badan, he can't fall sick. And slowly, around like 4 bulan, slowly the bacteria can go on. And untuk soalan yang berapa lama dia boleh show the symptoms, after infection, you can show the symptom between 1 to 3 months dalam lingkungan itu. Tapi ini it's related to berapa banyak bakteria yang ada dalam paru-paru. Kalau kita ada kurang bakteria, it will take maybe around 6 months also tak show symptoms. So it's level of the bacteremia in your body. So that is something to answer the first question. Second question, so how do we observe this in the scanning electron microscope? So ini more to research side already. But as what as I know, because TB resistant, I have not seen under SEM, but as what as reported before, whenever a bacteria is resistant, permukaan dia will have some changes. Okay, permukaan bakteria. Sebab bila kita berbincang tentang resistant pada bakteria, kita ada lingkungan 5 jenis resistant yang boleh kita bincang. One is dari segi nucleic acid, cell wall synthesis, protein synthesis, RNA synthesis, and so on. So I'm not very sure how does actually TB resistant to this particular bacteria work, but there always might be some changes if you can see in scanning electron microscope. Now, there will be some changes. I believe there is some changes compared to resistant and non-resistant strain. And I believe that kalau dia resistant pada satu ubat, changes dia tak banyak compared to beberapa antibiotic. I hope it answers your question. Yes?
Clear? Mas Imam sudah jelas?
Iya, sudah jelas Ibu.
Okay, now second question, Dr. Nisa. Please open your microphone, student.
Assalamualaikum warahmatullahi wabarakatuh. My name is Lina Sari. I want to ask about vaccine and treatment of TB. Someone who is infected with tuberculosis while undergoing combination treatment, whether it is carried out routinely or periodically, and are there any side effects? Thank you.
Maybe you can repeat the question a bit. I'm not getting the last part. Okay, assume a person is taking the BCG vaccine lah. Okay, I understand that. Because bila kita dah ada BCG vaccine, let's say just dalam lingkungan 6 bulan, kita dilindungi dari penyakit TB. We won't get TB. Okay, kalau pesakit ada penyakit TB, then doctor will start to give antibiotic treatment. Tapi jikalau badan kita dah ada BCG, dah beberapa tahun, then you take treatment antibiotic, dia tidak akan give any side effect. Should be okay. I hope I answer your question. It's good. Because usually kalau baru ambil BCG, you are protected. You won't, very rare you get infection. Infection berlaku sebab kita dapat like formulation. They give one during your masa you lahir as a baby. Next, they give during your sekolah rendah. Dalam lingkungan before 12 years old. Around that, in schooling time. When you are dewasa, kita tak dibagi TB, program vaccine against TB, unless you are infected or you feel you are sick, then you'll start to give treatment. So there won't be any side effect.
Okay, thank you, Miss.
Okay, maybe last question.
Please proceed.
Is there any question, Ken? Student?
We should take a group photo. Okay, Diva Kalista, what is your question?
Ya udah, siapa tuh Diva?
Okay, I'd like to ask about, according to World Health Organization, said that TB in children is difficult to diagnose. What are the factors that cause this to happen? And then what tests are effective to diagnosing the TB in the children? Thank you.
Okay. Thank you so much. Yes, in children, it's a bit to detect because you don't see them coughing and releasing the sputum like us adult. Collection, one of the factor will be the sample collection from the children itself will be tough. Kalau if you're telling children below 5, for them to give sputum, dia tak faham macam mana nak give sputum, so the parents has to collect from them. The challenges in the sampling itself. I hope I'm not too fast in explaining. Challenges in the process of collecting the sample. That's one of the factors. And secondly, you're asking what's the factors, right? You know, their immune system are not fully developed like us, the adult. So that could be another factor to actually challenging to detect TB positive when you do the ELISA test and skin test, which is quite difficult to detect. These are the common two methods they use. Aside from that, as we have a nucleic acid amplification can be used, or you can use the blood test method.
Okay, thank you, Miss.
Thank you.
Okay, maybe I have one question, Dr. Nisa.
Yes, please proceed.
What about risk factor for TB, like diabetes? Right now, diabetes is one of the biggest risk factor for
Yes, in
tuberculosis.
Malaysia, we have the same, don't worry. In Malaysia also the same, diabetes and
Yes.
obesity.
Okay, and then there are still a lack of management or procedure for screening diabetes in tuberculosis. What about this challenge? How could we screen the diabetes for tuberculosis? Thank you.
So, yeah, there's always a challenges to screen diabetes in patient with immunocompromised patient. One of the good example is diabetes. Second is cancer, organ transplant patient, and so on. So what we can do is the moment a patient with diabetes come to you, the first thing you can buat is you ambil patient history. Patient history, that means data bila dia dapat dia punya vaksin, close contact with TB patients and their clinical symptoms. So these are the three main things we have to do. And what are the risk factors? As you mentioned, diabetes. Aside from diabetes, warga tua, geriatric patients, cancer patients, mentally illness patient, even them, they do have a high risk to get TB. If they are already in a population setting, which has the trend of TB going up, they are also having a high chances to get TB. And not forgetting the major city where populasi manusia banyak, you have higher chances to get TB compared to perkampungan area. So this is one. And not forgetting, of course, kadar stres kerja. Kadar stres kerja also boleh menyebabkan one of the factor to you to get symptoms of TB easily because your immune system is low. Okay, that's all from me.
Okay, thank you, Dr. Nisa. A very clear presentation and very clear lecture today. Okay, I think because of the time,
Yeah, due to time interest.
yes, the time. Oke, teman-teman, terima kasih ya untuk yang sudah bergabung pada acara di pagi sampai siang hari ini. Thank you so much for Dr. Nisa for coming again with UNISA. I think it's our second meeting, Dr. Nisa. Last year, we also
With Parasite, yes.
yes, in Parasite. We also looking forward for your cooperation, and also we can sharing again about many things in laboratory diagnostic. Oke.
Sure,
Terima kasih
welcome.
teman-teman semuanya yang sudah bergabung untuk pertanyaan-pertanyaan yang sudah diberikan kepada Dr. Nisa. Sangat bermanfaat ya Dr. Nisa ya.
I hope the video helps. I hope the video was clear.
Yes, very clear. Oke, untuk teman-teman juga semoga dengan kuliah pada siang hari ini dapat kita refresh lagi untuk pemeriksaan laboratorium. Terima kasih atas kehadirannya. And oke, sepertinya saya kembalikan ke MC ya. Oke, terima kasih. Saya tutup. Terima kasih Mbak moderator dari mahasiswa juga yang sudah membantu saya pada pagi hari ini. Thank you so much. And Assalamualaikum warahmatullahi wabarakatuh. Silakan Mas Imam.
Baik, itulah tadi penyampaian materi terkait how to diagnose tuberculosis. Kepada dokter diucapkan banyak terima kasih. Semoga apa yang disampaikan dapat bermanfaat bagi kita semua. Acara selanjutnya yaitu penyerahan sertifikat kepada pemateri. Pada yang bertugas, silakan.
Thank you. So beautiful. Thank you so much. It's a very beautiful skirt.
Thank you, Dr. Nisa.
Skirt yang sangat bagus. I'll wait for your email. You'll email this to me as usual. Thank you.
Untuk pada dokter mohon kita akan melakukan tes foto dulu.
Ini sama Didit.
Baik teman-teman, sekarang kita masuk ke sesi dokumentasi. Bagi teman-teman dimohonkan untuk on cam. Masuk ini, ini kita berbikin ini. Ya teman-teman. Ayo teman-teman, persilahkan untuk on cam. Kita akan melakukan sesi dokumentasi.
Ada PT.
Baik, dokumentasi untuk slide pertama. 1, 2, 3. Oke, untuk slide kedua. 1, 2, 3. Untuk slide ketiga. 1, 2, 3. Baik, untuk slide keempat. 1, 2, 3. Baik, slide selanjutnya, slide kelima. 1, 2, 3. Baik, untuk slide ke-6. 1, 2, 3. Baik, serangkaian acara demi acara telah kita lewati bersama, tibalah kita pada acara yang terakhir yaitu penutup dengan mengucapkan hamdalah. Alhamdulillahirabbil alamin. Semoga kegiatan kita pada hari ini diberkahi oleh Allah Subhanahu wa taala.
Amin.
Saya Imam Ghazali dan mewakili seluruh panitia yang bertugas memohon maaf apabila terdapat kesalahan dalam menjalankan tugas. Akhirul kalam, wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much.
Thank you, Dokter.
Thank you so much, Dr.
so
Lisa.
much.
Dokter.
Selamat diagnose TB.
Yeah. Thank
Happy
you so much.
diagnosing TB. Bye
See you,
bye Puan,
Dr. Lisa.
Ibu Lisa. Bye. Thank you for inviting me and the moderator,
Thank you.
Isnin and so on.
Thank you, Dr.
See you all again next time.
See you, Dr. Lisa.
See you,
Thank you so
Dr. Lisa.
much.